tutorial, we will cover additional appointment features. To access the appointment screen, click Navigate, open your Perfect Care EHR folder, and select Appointment. The additional features will be in your appointment menu. The first one we will cover is code maintenance. This allows you to enter in additional codes into your appointment system, such as reason codes, visit types, reserved reasons, and patient locations. We'll start with appointment reason code. Here you see multiple reason codes already in the system. You can add as many as you like based on your practice. To add a new one, you would click the New button, type in what that reason code will be, its description. You see that you are able to stop it from printing a charge slip for any time this reason code is used by checking this box. If you have multiple charge slips based on visit types, you can select that charge slip that you want to print when a patient comes in for this reason. You can also select what color you want that appointment slot to appear when that reason code is used. Also, you can put in the minimum time requirement for this visit so that when this appointment is scheduled, it will automatically take up that much time. The next screen allows you to put a pop-up note in to make your staff aware of anything that needs to be done when this appointment reason is used. By dropping the pop-up configuration option down, you can select where you want this pop-up to appear, and then click Finish. You can delete reason codes by selecting it and then clicking the X at the top. And if you want to enable a reason code, show the ones that are disabled. They will appear in light gray, and then clicking the back arrow or the Enable button. Our next code that we are able to maintain is the visit type code. A visit type is what will appear in the appointment slot, letting the staff know what type of appointment to schedule. Here on my schedule, you see O's for office visits and P for new patients. To add, you would click the New, put in the code that you want to appear on your schedule and the description. Reserve reasons allow you to add additional reserves. On my schedule, you see that I use lunch for my reserve, which comes with the system, but you can add additional ones. Anytime you use a reserve code, it will block a schedule so no appointments can be added in that section. And our final code that we are able to maintain is our patient location codes. Location codes allow you to move a patient and show on the appointment screen what room they are located in. To add one, click New. Type in the code and then the description. Also in your appointment menu, you will see other options. Go to Today, Monthly View, Appointment Status, Waitlist, Reschedule List, Find Available Appointment, and Search Patient Appointments. These are also icons in your toolbar at the top of your screen. When reviewing the toolbar, you will see T, which takes you to Today. 1 allows you to see a schedule in a one-day view, and you're able to see multiple schedules. 5 allows you to see schedules in a 5-day view, but for one provider. 7 also allows you to see Saturdays and Sundays. The monthly view allows you to see a specific schedule and how booked it is and what available appointments are left in that area. Then you have your appointment status, waitlist, rescheduled appointments, available appointments, and appointment search. We will start with appointment status. When you select appointment status, it will show you the status of all patients scheduled today. By clicking on the date and clicking refresh, you will see all my patients scheduled today, who has arrived, and what room they are in. You can change your status if you want to see a specific provider schedule. And if you only want to see who's checked in, checked out, and also by location. The waitlist allows you to see all patients that are on a waiting list to come in. Your rescheduled appointment list will show all patients that have called in and said they will reschedule their appointment at another time and you've done reschedule later. Or also if you clear a schedule, all appointments that are on that schedule will move to the reschedule list. The Find Available Appointment allows you to put in search criteria to find a specific appointment. If we'd like to find an appointment for within the next week, you would put in that time frame. If it's for a specific doctor, you would select that provider. You can also select visit type, interval, and day of the week. So if I want to see the next available appointment on a Wednesday within the next week for Dr. Anderson or within the next month, I can put in a time frame, Wednesday, and search. This will then show me every time he has a Wednesday appointment available for the next month. I can select that day, double-click it, and it will take me to that week to schedule that appointment. The last icon is Appointment Search. This allows you to search for any appointments for patients in the future or in the past. So if a patient calls in and they're not sure when their next appointment is, you would look up that patient and select them, and it will show you any future appointments they have. And by clicking Include Past Appointments, it will show past appointments also. Along this side, you will see time and different time intervals. How you would like it to display as a user can be changed by right-clicking and selecting how you want to see it. So if I want to see it in 15-minute intervals, I can change it to 15, and it changes here to 15 minutes. If I want it in 10, I right-click and select 10. I can also right-click, increase the row height if I'm trying to see additional information. And I can also decrease it to make the time slot shorter. When I right-click on the date at the top of the column, I can clear a schedule, which will move all patients to the reschedule list. I can delete a schedule, which will completely remove the schedule from here and move all patients to the reschedule list. I can modify a schedule by clicking Modify. I can print the schedule and see and add schedule notes. I would like to show you Modify Schedule. When you click on Modify Schedule, you'll see the template that is currently on that date. To change that, you can right-click Schedule Day, click Schedule Rules, and see that day, and you can change that day by clicking on a section. You can delete it, change it, or if you'd like to completely change the template for that entire day, you can select Template. Pick what template you would like to change it to, and click OK. OK again, and then you will want to click Modify Schedule to save it. It will then, based on the day that you had selected, will show that information. If you want to change additional Mondays, you would just change this by clicking on the date and selecting on the calendar how far out you want this change to be. And as you see here, only Mondays are selected, so only Mondays will be changed. When I click OK, it's now telling me that if there's any appointments on the schedule that do not fit into this new template, they will be moved to my reschedule list. So I will say yes. Now if I close, I will see that my Mondays have been changed to the new template. I'm going to now show you what happens if you right-click and you clear a schedule. It's going to make sure you verify what you're doing by showing the parameters of this schedule. And you'll also see here, move scheduled appointments to rescheduled queue. You want to keep that checked, so if there are any appointments on there, they will move to your reschedule list. And then OK. It'll give you one more warning asking you if you're sure you want to do this, and you will say yes. So now my appointment schedule is completely clear. But if I go to my reschedule list, I will see all appointments that were on that schedule here. From the reschedule list, you can right-click and reschedule that appointment. You can open that appointment to get the patient's telephone number to call them to reschedule. And from here, you can reschedule or cancel the appointment once you call the patient. If you right-click on the schedule header, you can also delete it, and it will completely remove the template. This concludes the tutorial on additional appointment features. If you have any questions, you can please forward them to questions@ncgmedical.com, or you can call the support helpline at 1-800-330-1906. Thank you for your time.